On April 26th, 2016, I experienced the worst pain I could have ever imagined, as well as the greatest relief and joy of my entire life. That was the day that my son was born. For me, it was an excruciatingly slow process, one that I fear could have ended differently without the intervention of fentanyl and an epidural. It was a controversial call for me to make when I asked for the pain medication and an epidural. Many mothers, professionals, and well-meaning bystanders condemn the use of such pain relief options for the fear of the harm it could cause. I do not agree with them, and think that if a mother wants those options, she has every right to choose them without any backlash or guilt. I believe this because epidurals and pain medications during labor and birth are not as dangerous as some make them out to be. Also because a birth should be a good experience, and pain management is one way to achieve a better experience. Epidurals are the most popular form of pain relief during labor. More than 50% of women giving birth in a hospital use epidural anesthesia. It is a regional anesthesia that blocks the nerve impulses from the lower spinal segments, which decrease the sensation to the lower half of the body. The epidural is administered by inserting a small catheter or tube into the lower spinal cord. This provides a place for periodic injections or continuous infusion. From personal experience, I can say that it is extremely effective in diminishing the pain of labor, including strong contractions. Recently in our world, there has been a push to return to the natural, that we should be eating a vegan diet and wearing organic shoes and having an all-natural birth. One of the biggest arguments against epidurals and for natural birth is that it can be dangerous to the mother and baby. Some of the recited risks include a drop in blood pressure, leakage of spinal fluid, the slow down or stop of labor, shivering, backache and soreness at the insertion site, ringing of the ears, nausea, difficulty using the restroom, increased need for forceps, vacuum, episiotomies, and cesarean delivery, numbness in the lower body for hours after birth, permanent nerve damage, difficulty breastfeeding. The baby may experience respiratory depression, fetal malposition, increase in fatal heart rate variability. It is a long list. Some risks mentioned are minor, but every aspect should be considered when deciding. In the heat of labor, I didn't care if my ears were ringing or if I was shivering. Not to mention, being numb hours after birth was a plus in my opinion. Others on that list are more concerning, such as permanent nerve damage. Good news is that the severe side effects are rare. Take leakage of the spinal fluid, for example. Less than 1% of women experience this side effect. William Kaman, MD, says, most anesthesiologists will go through a whole career and never see a case of these rare complications. Yes, there are risks to epidurals, but taking into account the numbers, the chance of these side effects happening are slim. To accompany the long list of risks, there is a corresponding list of benefits. These benefits include pain relief, allowing the mother to rest, having a more positive birth experience, allowing the mother to stay alert, and overcoming exhaustion, irritability, and fatigue. I personally was able to take one of the best naps I've ever had after getting my epidural. This allowed me the time to rest and gain the energy I needed for the coming hours. Labor and birth is a hard experience, and epidurals and other pain medications can make this a much easier process for some women. One of the benefits listed of the epidural is a more positive birth experience. Through my whole 9 months of being pregnant, I was constantly badgered with advice and posts and articles telling me that birth was going to be a great, wonderful, and empowering experience. They might have oversold it a bit, but they were correct that it should be. Many women do not have a good experience, though. Sadly, 9% of women experience postpartum post-traumatic stress disorder. That means that 9% of all the women that give birth have such a bad traumatic experience, they're left with PTSD. And that's not taking into account the 15% of mothers that experience postpartum depression and the 10% that experience postpartum anxiety. While giving birth to my son, near the end, I couldn't breathe, along with other complications. That left me very shaken for the following months, terrified at some point that I wasn't going to be able to take in my next breath again. Although the complications that I encountered are not normal, they are in no way as severe or as frightening as some women have had to go through. Unfortunately, we're not able to prevent all birth complications, but there are things we can do to help it go smoothly. Some we can do on our own, others we need assistance. This assistance can come in varying forms, such as a supportive spouse or family member, a doula, the doctors and nurses, and in some cases, anesthesia and medication. A mother-to-be prepares herself for birth by finding and learning strategies to breathe, remain calm, and to ease the pain. Some pick a spot on the wall to focus and power through. Others rope their husband into rubbing their back, and some get an epidural. With the benefits I listed earlier, the mother can be rested, focus easier, and remain calm. This allows for less stress, fatigue, and pain, which permits the mother to be a more active participant in the birth. This is the day that the mother finally gets to meet her child. It's unfortunate that it should be a day that is dreaded by her instead of looked forward to. And a mother should be able to do everything she can to make this day easier on her and her baby. Every birth and every mother are different. Many women strive to have and accomplish a natural birth, and I admire that completely. But for some of us out there, that was never going to be an option. And thankfully, there are options to manage the pain. Of the best ways to do it is an epidural. There are risks, just like everything in life. Birthing a child is a risk, but modern medicine has made it safer for us. With the help of an epidural, it can make the day of your child's birth a much more bearable and enjoyable experience. An all-natural birth is an amazing thing, but if you choose an epidural or other pain medications, don't feel guilty about it. For everyone out there, mothers-to-be, supportive fathers-to-be, or other relatives, I encourage you to seek whatever type of birth works best for your family.